So I'm Charlie. I'm going to review the use of our Plum or Hospira pumps. I already have my primary and my secondary set primed and in the cassette in the pump. The first thing I want to point out to you is the clean sticker. These are new to our hospital, and that just indicates that the pump has been cleaned by housekeeping, so that's important to look for. On the inpatient side, these pumps are cleaned by housekeeping, and on the ED side, they are cleaned by nursing, and they are to be cleaned with Virex and just the soft towel or paper towel, and not the Sani wipes. That is per the manufacturer's recommendation. So once you have your primary set primed and in the pump and your tubing connected to your patient, you're going to want to clean with alcohol for 15 seconds and then attach to your patient. You can then power the pump on with the orange on-off button. It does take a few minutes for the pump to do its self-checks. The first screen that you're going to come to is the unit selection. Most of our pumps on Pediatrics will come up defaulted to Pediatrics highlighted, but there are some instances where you may have borrowed a pump from another unit where you may have to use the arrow keys to scroll to find PEDS. So once PEDS is highlighted, you're going to want to hit enter. And we'll ask you if you are programming for a new patient. So if this is your first time running an infusion for this patient, you're going to want to hit yes. If for some reason you had disconnected your patient to go to the bathroom or to go off the unit for a test, then you're going to want to click no, because that will save all your settings that you had used previously. So we're going to hit yes for new patient. The next screen that you come to will show both your primary and your secondary. Your A is your primary setup, your B is your secondary setup. And we're just gonna walk through how to set up a primary infusion. So you're gonna click A for primary, and then you're gonna enter the rate and the volume you want to be infused. So if we're running maintenance fluids, for example, at 100 cc's, and volume to be infused at 100 cc's. We do want to make sure for our pediatric population for safety that we do only infuse 1 hour and 1 hourly rate at a time, to make sure that we come back in every hour and check our IV site. So make sure that you don't set your pump for any more than 1 hour times 1 hour of your rate. The next thing you're going to want to do is click your drug list, because you want to make sure any IV fluids or medication that you are programming on the pump are that you're using the guardrails for that drug or IV fluids. When you hit enter or the drug list, you will see the IV fluids first, and then the medications come on later pages. The most important thing to remember here is that you're going to want to use the page up and down arrows first to get to the page that displays your fluids or your medication. Then use the up and down arrows to actually select. So for example, if we were just using plain IV fluids, for example, normal saline on a patient above 40 kilograms, we would have to page down and then select IV fluid above 40 kilograms and click enter. And then you'll see that up here on your left-hand side under the A. The next option you have is a standard program, a loading dose, or a multi-step. Most often on our unit we use the standard program, which is just your volume over time program, but you do have an option for a loading dose. This gives you the option to, and you would click choose, to, for example, if you wanted to set a bolus and then the maintenance rate to run right behind it, you could do 2 different setups there. If you decide that's not what you want to do, at any point you can just hit cancel back and then go back to your primary. The third option was a multi-step. Again, we don't use that a lot, but an example would be for IVIG or something like that, where you want to do increments of a rate. So for example, you wanted to do 20 cc's for an hour and then 40 cc's for an hour and keep ramping the patient up. That would be an option that you you could use, and that's the multi-step option. So again, the primary, the rate, the volume to be infused, page down and page up to select your medication or your fluid, and we're going to do just the standard program because that's most often what we use. So you're going to click choose. Again, you just want to confirm your rate and your volume, and then click start. Again, it will ask you to confirm every time you make a change to the pump. So you click yes, and you see that you're pumping. The next thing we're going to do is review how to run a secondary medication. So your primary line is running, your IV fluids are running, and you want to hang your antibiotic, for example. I already have my antibiotic primed. You're going to want to just make sure you cleanse the hub for 15 seconds with alcohol before you attach your secondary tubing. You can keep your IV fluids running, your maintenance fluids running, and then you're just going to click B for your piggyback. You do have two options. You can do piggyback, or if, for example, you are running a medication like potassium, you would want to click the concurrent mode, and that means that you're running your IV fluids and your medication at the same rate, or piggyback, which means your IV fluids stop while you infuse your medication. So for our example, we're going to use the piggyback mode because that's what we use most often. If you did need to change it, you can just click the option change mode, and that will change it to concurrent for you. Again, you will arrow down for the rate. So for example, we're running at 100 mLs an hour, and your volume to be infused, for example, which is 50. For exactly like you did with your IV fluids, you're going to want to make sure that you click your drug list and that you select the appropriate medication. Again, page down. There are antibiotics listed. If you do not see the antibiotic that you are running listed, you can either choose antibiotic 50 ml or antibiotic 100 ml. There are several options for just a generic antibiotic if you don't see the specific antibiotic that you're using. So we can choose antibiotic 50 ml. If it's anything below 50, you're just going to choose the generic below 50 ml and click enter. Again, you have the three options: standard, loading dose, and multi-step. Again, we're just going to use the standard program. And then again, you're going to click start. You will get your confirmation message. Do you want to deliver 100 mLs at 50 mLs at 100 mLs an hour? And you're going to click yes. And then you're going to see this at the top. Your A side is delayed, and your B side is pumping. Your secondary is infusing because you selected it to be run as piggyback. Under your A side, your primary, you're going to see your guardrail for IV fluid above 40 kilograms. And on your B side, under your medication, you're going to see an antibiotic 50 mLs. Another thing that you might need to do, especially on the inpatient side, is clear your volumes for your shift. If you click options, you will get the option to select volume infused. So you'll select choose. The most important thing, I think, to remember when you're clearing the volume, when you hit clear down here on the bottom, you have to hit enter for it to actually clear the total. If you just hit clear and do not hit enter, the screen will flip back and your volumes will not be cleared. A couple other buttons on here: the silence, of course, is important. The stop and starter in red and green, and then of course your on off. A few troubleshooting things just to talk about. You'll see here on the bottom, when you have two things running, you do have the option, if you want to stop the infusion for whatever reason, to stop all or to just stop your A side or your B side. Another alarm that you may get is distal occlusion, and that means that there is an occlusion somewhere below the pump. So when you have, when you see an alarm for distal occlusion, you just want to check to see that your tubing isn't kinked anywhere below the pump, and of course check your IV site. You may want to flush that with some saline to make sure that your IV is still patent. Once you have fixed the problem, if you hit start and start either all or start A or B, then your infusion will resume. The other alarm that we frequently see is proximal occlusion, and that means that there is an occlusion above the pump. The most common cause of that is that your secondary tubing is clamped, but it may also be because the tubing has kind of flipped over here at the top of the hub and has caused some air bubbles to get in your cassette. The way that you can fix that when it alarms is you will get this back prime feature, which is always on the first arrow, and that will give you the option to back prime either into your secondary, into your primary, whatever is running, or into an empty syringe. You can just attach an empty syringe onto the top of your hub and back prime fluids into that empty syringe. And to back prime, you're just going to click the back prime button and hold it down, and you will see the air bubbles going up into your bag or syringe. Another couple things to remember, if you are scanning medications, if it's an antibiotic, if it's a mini bag, it's important to scan the patient label and not the antibiotic, because that will give you the most correct scanning rates. And of course, if it is on the ED side and you're having problems scanning your IV fluid bag, it's most likely that you're scanning the incorrect size bag. For example, the physician ordered the bolus to be run in a 500 cc bag and you've hung a 1,000 milliliter bag. Our IV tubing is changed for the primary set. It's changed every 72 hours. The actual IV fluid bag is changed every 24. And for the secondary set, if you are connecting and disconnecting, you want to change that every 24 hours as well. The same for the syringe pump, you're going to want to change that every 24 hours. The reason we use the guardrails, which is making sure that the medication is programmed, is so that we keep our patients safe and that we don't deliver the wrong amount of medication to that size patient. So for example, a medication like heparin or potassium, we want to make sure that we are within the guardrails for that drug, and that is why it's so important to label your medications.